Hi everyone, it's Tracy from Downward Dog Rising. Welcome. Tonight I'm going to give you a workout. It's more of a release for your shoulders, your neck, and your mid-back. So if you feel tight from sitting too long, whether you're sitting at a desk or you're driving, then this session's for you. And you're going to need a foam roller, all right? Because we want to release the neck, the shoulders. So I'll give a couple little releases, and then I'll have you do some stretches, and then we'll finish up just like that. It won't be too long of a workout. All right, so if you have a foam roller, spread it onto your mat right down the center so it's vertically down on your mat. Take your tailbone, sit on the end of it like this, bend your arms, roll your back onto the foam roller, and then maybe you'll adjust yourself so you're centered. Be careful that your tailbone's not hanging off the linen, and then be careful that the neck isn't unsupported. Notice how my head is not hanging off the edge. My entire neck is on here. And that's what you're looking for, so you have support. And then foam rollers come with different consistencies. Some are soft, medium, and then some are super firm. So you'll just have to see what you respond best to. If you like a deep tissue massage, you might like a firm one. If you don't like a deep tissue massage, then make sure yours is pink or blue, a little bit softer. So let's start. Take hands straight above shoulders, and then I want you to just do a micro motion. Your shoulder blades lift off the mat, off the foam roll, and then they reset. We actually call this protracting and then retracting the scapula, the shoulder blades in your back. They move away from the center of your spine, and then they reconnect to the foam roller. Feel sides of neck elongate under the earlobes. 5. They come back down. 4. Space starts to open up mid-back between shoulder blades. 3. Your thoracic spine. 2 more. And last one. Add on, we're going to do screw in the light bulb where you lift, rotate thumbs to outsides of room, so your thumbs rotate away from you. Thumbs rotate towards center and pull those blades back down. Inhale, exhale, the blades come back down. Inhale, rotate those arm bones deeper into your shoulder socket, the glenoid fossa. Inhale, exhale, working with the bones, natural rhythms. When we get tight, our shoulders hike, internally rotate. So now we're pulling them down, back, and then rotating them externally into your joint, your shoulder joint. 4, 3, 2 more. Get a release, last one. Now just scissor arms. One arm goes behind you, one arm goes down, shoulder stays away from your ear. Take a really deep inhale into the mid-back between your two shoulder blades. There's 8. Inhale, exhale, 7. Feel some space open up between your two shoulder blades. 6. 5. Pull and integrate the front of your ribs down together. Avoid popping ribs to sky. Pull them down together. Inhale, exhale, 3. Inhale, exhale, 2. And last one, excellent. Now arms come by sides. Do a set of shoulder shrugs for 5. Shrug shoulders into your ears. Release the tension through the fingertips. Shrug shoulders up into your ears. Release the tension. Reach fingertips long. 3 more. Shrug them up. Release down and back. Feel the collarbones wide. 2 more. Lift and lengthen away. Last one. Shrug them up. Pull down, back. Now float the arms up. Only reach behind head to the point where the top of the shoulder doesn't hike up like that. Keep shoulders away from ears, chest wide open. Now do a circle. Inhale, reach it back. Exhale, circle. Let's do 6 more, around and back. Feel chest open. 5, spine is long, collarbones wide. 4, exhale. 3, inhale, exhale. 2 more. And last one. Reverse, chest opens wide, shoulders out of ears. There's 8. Tighten your core to your spine. Keep balanced on your foam roller. 7. Shoulders stay down the whole entire time. 6. Inhale. Exhale. 5. Inhale. Spine elongates. 4. 3. Tighten core to low back. 2 more. Inhale. Exhale. Last one. Breathing in. Breathing out. Wonderful. Slowly pick a side that you're comfortable rolling off to. And then you would just go like that. Roll off the foam roller. Come onto your mat. Now what do you feel? Your 2 shoulder blades should be completely indented into the mat. You'll feel them touching the mat, where before when they're all tight and like really super tight and ischemic without oxygen, you'll feel like they don't touch the ground. Now they do. So that'll feel really nice for you. So this next thing is very important. We're going to go under the 2 shoulder blades, middle back. So you're just going to curl up, come up here, under the 2 shoulder blades, not on the neck, below the 2 shoulder blades, not on low spine, mid back. Take your foam roll, under the 2 shoulder blades, mid back. Now what I want you to do, careful you don't roll over your hair, and then you can support your hands behind head and neck, so you're under the shoulder blades. And then I just want you to do this little baby back bend. Support the back of the head and the neck. Cradle your hands under the head. Exhale. So a little bit of thoracic spine back extension. Inhale, open. Tighten the core to your back. Scoop in. Lift back into neutral. Inhale. Exhale. Keep those elbows wide. Just get a little motion in through the middle of your back. 5, inhale. Exhale. I'm not even having you roll over mid-back, just bending over the foam roll, doing a little supported back extension. 4, scoop core in tight. 3, open up that spine. 2 more, inhale, exhale. Last one. Reach back, come in. Okay, now very important. We don't put all our body weight through the neck vertebra, and we don't do it on the low back. So what you do, come all the way down so your back is on the mat. Notice how my shoulders are on the ground and it's just my neck that's on the foam roll. That way you don't hurt the neck vertebra. Now turn, look over one shoulder, start to release the side of your neck. Turn and look over the other shoulder. And go really easy and slow. Just massage the back of the neck, the back of the skull. Inhale, exhale, avoid forcing anything. Be very careful if you've had cervical spine surgery or any fusion. You don't want to do things to undo the surgery, so just be very careful and cautious. Know what your limitations are. Check with your doctor first. Side to side, releasing the neck. Now as you look over one shoulder, tilt chin down, just a baby bit. That stretch moves up to the side back of the neck. Come in center, rotate, look slightly down. Center, up, rotate. Let's do several more like that. Look down. Inhale, exhale. 4 and 3. Easy and slow. 2 more. And last one. Awesome. Now we're going to take our foam roll out. Just doing these little releases, not too much. Now with your head on the mat, your shoulders are relaxed down by sides, your legs are just like in a constructive rest position, knees bent. This is really good to help release the hips. You're just going to tilt the chin towards the sky, chin nods. Chin tilts up and then chin tilts down. So this releases at the base of the skull, the occiput. It's just a small range up Your head doesn't even lift off the mat. It's just tilting chin up, chin down. Get right at the base of your skull. Relax the face, the jaw, the mouth. Come back into neutral. Okay, take the very tip of your nose to the ceiling. Make a little circle with the tip of your nose. Feel the sides of the neck elongate under each earlobe. Little baby circles one way. Now do little baby circles the other way. You're releasing tension. Inhale. Exhale, just little baby circles. Gently return center. Okay, now what I want you to do, you're going to take your foam roll. This is for your low back, stability of the pelvic girdle, lumbar spine, stabilization. Now place your feet on your foam roller. It's an unstable surface, so you're going to have to really tighten the core to your back. Remember, you don't want a pillow under the head. Keep that neck long so you don't hurt the neck. Collarbones are wide. Space across chest, shoulders. Your arms reach long. Now mind, body, turn your glutes on. Engage those hamstrings. Engage your glutes first, and it goes all the way down the chain. Push into the bottoms of your feet. Your arches are over the foam roll. Now elongate your tailbone. No weight in neck. Feel the length. Press up. Integrate ribs. And then just lower pelvis down. Use your core. Inhale, exhale, just lift up. Reach that tailbone far away and lower hips down simultaneously. Knees are aligned, middle of knee joints aligned over second toes so that patellar tracking. Middle of kneecap over second toes, tailbone long. Feel how it opens the chest, your shoulders are down. You'll feel tone in your glutes, even backs of thighs because your feet are elevated. You're on an unstable surface. Let's do 5 more. Really engage your core. Stretch the tailbone long. So if you sit for long periods, your low back can get compressed. 4. Reach that tailbone. Feel the length in the low back. 3 more. Exhale. Scoop in tight. 2 more times. Chest is wide open. Exhale. Inhale down. Now 1 more time. Exhale. Slowly bring pelvis to mat. Awesome. Just hug your knees to your chest. And just let your back sink even deeper into the mat. Stay here for a second. Inhale. And then exhale. 2 more. Deep inhale. Exhale. And 1 more time. Inhale. Exhale, release. Excellent. Next, we're going to get rid of the foam roller. We could actually use it as a challenge under our hands. We're going to roll to our side. Give your body a second to adjust. Press up slowly. Okay, we're going to go onto all fours like this. And then what I want you to do here, you're on your hands and your knees, curl your toes under. Now, get the energy out of the wrist by elevating your sternum. Your breastbone lifts. Press the 2 shoulder blades open and apart. Lift the energy out of the wrist. You're not sinking down, but you feel it go under the armpit, across the middle back, under the shoulder blades. And then you slowly start to stretch your tailbone away from you. Pull your heart through the arms. Extend the spine. Do a few cat-cows. Drop your chin. Drop your tailbone. Lift the breastbone. Press palms away. Inhale. Head stretches away from tailbone. Lengthen the spine. Exhale. Lift up your breastbone. Shoulder blades wide to the sky. Drop your chin, drop your tail, and lengthen and pull apart. Now lift the chin, stretch tailbone away. Exhale as you drop chin and tail. Spread the shoulder blades wide. Scoop, dome the abdominal wall into the interior of the spine. Lift against gravity towards low back. Stretch head away from tailbone. 2 more. Get that spine to extend. Exhale. Just let your spine release. 1 more. Stretch apart. Exhale. Now find your neutral spine. Your tailbone elongates. Your head stretches forward. The front of the ribs and the back of the ribs meet in the middle. So you get rid of the arch. Now you just turn, look over one shoulder. So you're going to stretch the whole side of the ribs apart on the other side. Come back center. So here's your lateral spinal flexion. Look over the other shoulder. Feel those ribs open apart. Shoulder away from ear. Inhale, center. Look over the shoulder. Your hip and your shoulder come closer on one side. The other side of your ribs opens apart. Come back to the center. Other way. Shoulder and hip move closer together. Lateral spinal flexion. Come back center. Last one. Look over the shoulder. Come back to the middle. And 1 more. Shoulder and hip come closer. Inhale, exhale. Now I want you to return to the center. Your hips stay squared, facing your mat. Very important so you don't bother your low back. You scoop the core tight. Open the collarbone wide. Now reach under this arm. And then you're going to relax the shoulder, the side of the head and neck are on the mat. Pull those sits bones behind you. Create the length in your low back. Stretch those ribs. Your hand could either stay here, directly under your shoulder, or you could slide overhead. Keep sending those sits bones pulling back behind you. Thread the needle. Breathe. Let the sides of those ribs expand. Getting a little mobility through the center of your spine, thoracic spine. Inhale. And then exhale. Breathing in. Get the side of that neck to lengthen, shoulder out of ear. Inhale. Exhale. 2 more times. Breathing in. Exhale. And 1 more time. You're going to inhale. Exhale. Softly release. Slowly slide your hand in. Press back up to your hands and your knees. Find your neutral, facing the opposite direction. So you're on your hands and your knees. Feel as if, do 1 cat-cow. Drop your chin, scoop in tight. Lengthen head away from tailbone. Now front ribs meet back ribs. Connect, lengthen, so scoop in. This part of your spine lengthens. Your hips stay squared to your mat. Inhale as your collarbone opens wide, shoulders are away from your ears. Rotate from the center part of your back between the shoulder blades. Deep exhale as you thread the needle. You drop your shoulder away from the ear, the side of the neck lengthens. You want to send those sits bones pulling back behind you. Create some length in the low back and the shoulders down away from the ear. Maybe your hand is directly under the shoulder. Keep the shoulder away from the ear. If you do choose to stretch arm overhead, you're making sure not to elevate the shoulder to hike it. Send those sits bones back. Breathe. Really feel those ribs open apart. Inhale. Exhale. Feel that air go into the deeper lobes of the lungs. Use the breath. Inhale. Exhale, getting the oxygen into the lower lobes of the lungs. Feel the lateral ribs, the back of the ribs inflate. Open that space between the ribs, those intercostals, stretch apart, muscles between your ribs. Inhale. Exhale, soften the breath. Let go. Sits bones pull behind you. 2 more times. Deep inhale. Exhale. And 1 more time. Deep inhale. Exhale. Softly, gently bend this arm. Press into your palm. Lifting back up. You're on your hands and your knees. Now slowly crisscross your ankles. Sit back. And then what I want you to do here, I want you to just feel like you can lift up your heart, breathe. 2 more times, just lift up your heart and breathe. 1 more time, lift up your heart and breathe. Now you're going to take your hands, elevate, inhale, and then just press your 2 shoulder blades apart in your back. Maybe bring hands together, inhale, and then scoop core in tight. Exhale, 2 more. Open, open, open between those shoulder blades. Exhale, 1 more time, inhale. And exhale. Excellent. And then we're just going to face forward, crisscross our ankles, and then sitting tall. It's like you're sinking down into your sits bones. Take one hand to the opposite knee. Lift. Sits bones stay rooted, grounded on the mat. Turn, look over your shoulder. Come back center. Now you're just going to take opposite hand to knee, lift your heart, turn, look over the other shoulder. 2 more times, inhale, exhale, and 1 more time, breathing in, exhale, return center, couple little shoulder rolls, they lift up, down, back, away from your ears. 3, release the tension through the fingertips. 2 more. 1 more. Slowly, softly reverse your direction. Lift, roll forward for 5. Release that tension, collarbones wide. 4. 3, release any tension. 2 more. And last one, wonderful. Now stretch one arm by your side, that's your anchor point. Your collarbone opens wide, your neck is long, so we're gonna elongate this whole side open, and then ever so gently just tilt ear to opposite shoulder. Breathe. Feel how it lengthens sternocleidomastoid muscle in the side of your neck. One more deep inhale. Softly come center. Take this other arm, shoulders down, away from ears. Stretch this arm. Feel this collarbone open wide. Just be careful. Sometimes one side's tighter than the other. Move slowly. Use that anchor point. Tilt opposite shoulder towards ear. Get that release. Breathe in. Exhale. Keep stretching that arm away. That's your anchor point. Inhale. Exhale. Breathing in. Exhale. Let the side of that neck release 1 more time. You're going to inhale. Exhale, softly, gently release. Excellent. Return head center. And then just imagine press top of head to ceiling. So you feel both sides of the neck lengthen. You keep pressing top of the head to the ceiling. And you want to elongate your spine. That axial elongation of your spine, lengthening into 2 different directions. Sink down into your sits bones. Take a deep inhale in. And then just gently bring hands to your heart. Wonderful. And Anjali Mudra, 1 more time. This concludes our release the shoulders and neck session for tonight. Hope this helped. Hope you feel a little bit more loose around the shoulder, neck area, mid-back. If you like my content, please hit share, like, subscribe. Thank you so much, and I'll see you again soon. Peace, everyone. Take care. Save this to your playlist for those times when you've sat too long at your desk or you drove too far and you just feel uncomfortable. Save this so it'll help you release a little. All right, peace, everyone. Bye. Hope this helped. Bye.